Hello and welcome to the third module of HSM 220. And for this class, the topic is introducing you to healthcare policy. There are three learning objectives. The first is going to define what health and health policies is. Going to define public health and talk about the three domains of public health. And then finally, describe a brief history of health policy reforms in the US, kind of talking about the ones that failed and the ones that succeeded. So let's get into it. So, what is health and what is health policy? Health is a state of complete physical, mental, and social well being, and not just the absence of diseases. And this is a definition that is according to the World Health Organization. So, this is how we understand what health is. It's just not when, let's use for example, somebody is not sick. That's not what it means to be healthy. When we're talking about health, we need to consider both the physical, the mental, as well as the social well-being. So, what health policy does is it makes an attempt to make health happens, to bring into actuality health in practical. And it does that by attempting to address the issues that leads to people not getting optimal health, such as not having access to health services or having access to health services but the quality is low, or having access to health quality but the cost of getting those services are too high, therefore not being available. So that is what health policy tries to address all of this. And it does that through legislation, and this could be pertaining to individuals, or it could be looking at our communities or organizations. It also does that by attempting to influence each component of the determinants of health framework directly or indirectly. I'm going to talk about what the determinants of health is. So in case you're wondering at this point, what does that mean? Don't worry, I'm going to explain it. And ultimately, the goal of health policy is to provide equitable and efficient access to and ensure the quality of health and health services. When we say equitable, we mean equal, more or less, whereby one needs to be able to get health regardless of their sex, their gender, their age, their religious beliefs, or their political standing. That is what we say when we talk about equity, being able to provide equitable health. So that is what health policy aims to do. So these are the determinants of health. You have the environment. When we talk about environment, we're looking in terms of policy. This is not strictly only not strictly health policy. Could be looking at different types of policies. It's also looking at communities, looking at the family. With the health status, we're looking at physical, mental, social well-being, and with medical, it looks looking at organizing healthcare, financing healthcare, delivery healthcare, and in terms of individual characteristics, is kind of interested in one's demographic, such as age, sex. Gender, that sort of thing. And he's also looking at the behavioral side of individual characteristics and one's social economic side. So he really tries to look at all of these different things. This is what determinant of health is. And health policy tries to address as many of these components as possible. It may not always be feasible, but at least an attempt to do so is done. So, what are the determinants of health policy? When we are making the decision about what health policy we should be focusing on, some of the things that come into it is, making decisions or asking questions about what is the nature of this health policy. And when we talk about nature of the health policy, we're talking about in terms of magnitude, in such as, are there many people who have this health policy? We could also be talking about severity. Severity in the sense that even if there are not many people who have it, but for the people who have it tends to have very dire consequences for them. So it's not just about numbers in this case. It's just about how much the health problem affects them in the manner in which it does so. And then also other determinants of health policy is social cultural norms. In this case, we're kind of looking at it in terms of what are the accepted values that the society has, what are the beliefs that they hold, the social norms, the attitude one has towards not just health, but in just every other aspect of their lives. And then you have a behavior of a society or of a group. Let's use, for example, if there is a behavior that leads to a group of people not, if it reduces their access to healthcare, health policy will be interested in trying to address those behaviors, so that in doing so, it clears off the road and make those health services available to those who need it. And then we have the political system, which is a determinant of health. With a political system, it says here democratic versus single party, but it's not really as simple as that. Of course, in a situation whereby you're dealing with a single party government, whereby only one party is the one, year after year, election year after election year, they're the only people who tends to win. There's nothing else that can happen with any other person. It just means that only the views or the values that that party has are the ones that get enacted of the laws. But when there is more democratic and you have different people coming with different political views, and you know that there's a likelihood that if you don't do what the majority of people want, you can get voted out. And so this has to be that trade and barter that happens with it. So this is all the things that determine health policy. So, what are the different types of health policy? We have regulatory health policies. Kind of is a tool that the government used in trying to prescribe and control the behavior of people. An example would be the policy that made it such that one cannot smoke indoors, and if you want to smoke, you have to go out to smoke. That is an example of a regulatory health policy. And private health policies can also be regulatory in the sense of individuals in their different companies, in their different organizations can have its own regulatory policies and stuff like that. And then it can have, there's also allocative health policies. What allocative health policy tries to do is the distribution policies. For instance, if, let's use, for example, people who are low income versus people who are high income, a distributive policy might be in a situation whereby those who are in low income get to access healthcare services for free, but those who are high income get to pay for healthcare services. So those are the kind of distributive policy that health policy tries to look into in a way of doing as much as it can to provide equitable access to health services and healthcare. And the retributive policy also means taking money from one group and giving it to the other in the way that insurance does, where everybody pulls in money. Those who are wealthier, particularly if it's a kind of insurance that does it such that the more you get paid, the more contribution you make. And then those who don't get paid much, they don't have to make as much contribution. That is a kind of a redistributive policy whereby it tries to take more from those who have a lot and give it to those who don't have quite as much. So, what is the importance of studying health policy? Why are we doing this course in the first place? One of the things in the importance of studying health policy is that it is a first step towards influencing policy. You are all health students, so you're going to, in one small way or the other, have some influence when it comes to policy. It may not seem as much, but this could be the first step for you, towards that. And it does allow us to be able to engage in the process or in the efforts of improving it. You may not be drafting any policies, you may not be, all out in the campaign trails and stuff like that, but you may be able to have conversations that are related around that. So it does, by being well educated about health policies, then you can be able to have conversations about that. And of course, we do know that health policy influences how population health happens, and it does that because it's an integral component of health, the health determinants. It influences other determinants of health. For example, if you don't have good health, you're very unlikely going to be able to go to school or concentrate in school. So you find that health, influences so many other things that is going on in your life, and so now let's get into the second learning objectives. We're going to talk about public health here. What is public health? Some of you may have heard about this term before. So there's a very, very long definition of public health by Winslow way back into 1920. And this is a very long quotation. I'm not going to say it, read it all out. But one of the things I have highlighted, some key information you should know when it comes to public health is concerned with preventing diseases, is concerned with prolonging life, promoting health, physical health and efficiency, controlling community infection, educating individuals, and basically early diagnosis and preventive treatment for diseases. So this is the domain of this is where public health kind of domiciled. And in a nutshell, this is what public health is. Geographically, public health is focused on specific community or in countries in sometimes. The cooperation that public health does is a lot on the national level, but it does do some on the state level, the local level, but a lot of public health initiatives do come from the national level. And public health does focus a lot on prevention, but it also does disease control. Using the example with COVID, how much public health kicked in and trying to promote mask wearing, promote vaccination, and all of those things. This is a lot of where public health kind of works in terms of access. Public health is very much concerned about building or working towards health equity, and this could be within one's nation, it could be community. When I say health equity, think of it in this sense, in the sense that health equity is trying to make sure that everybody gets the kind of healthcare services that they need. So that is what I mean. Then discipline. Public health is very multidisciplinary. There's a lot of health study science that goes into it. There's also a lot of social sciences that go into it. So it's very multidisciplinary. So, what are the domains of public health? From the definition that I gave of Winslow, you can imagine, already guessed it has a lot to do with health improvement, whereby it tries to cover key aspects to reduce health inequalities. Health inequalities meaning in such a situation whereby one group of people have a worse health status than other group of people. I'm going to leave it at this point because if I go any further, it may get confusing for you guys. So I'm just going to leave it in saying health inequalities is such that one group of people have worse health than the other group of people. So that is what public health tries to do, trying to reduce those health inequalities. It does try to involve engagement. with structural determinants of health in terms of improving housing or increasing one's access to employment and things like that. It's also working with individuals and community to improve health through disease, preventing disease in terms of adopting healthy lifestyle. For example, trying to encourage fresh food by trying to get communities involved in community gardens and stuff like that. This is all the domain of public health. Other domains of public health includes health protection, uh, control and prevention of infectious disease, responding to emergencies like what happened with COVID, and engaging with the regulations of clean air, water, food, preventing or dealing with environmental hazards. So this is where public health does come in, and it does do some work in health services improvement, whereby it tries to engage with different healthcare professionals, not just the public health professionals, but including clinicians, in trying to get away of having a healthcare service being delivered in such a way that there is health equity. And it does promote clinically effective practices through promoting evidence-based care. By evidence-based care, we mean that the science has gone in there, and there's been a lot of research that came out and say, yeah, this works, and this is the way that it works. So that is what we mean by evidence-based care. And it does support clinical governance in terms of planning and prioritizing services, and just making sure that research is done well. And when projects are done, health projects are done, or health programs are done, or planning, it goes in there to make sure there is auditing and there's evaluation, so that what we get out of it is actually what was promised that it will come out of it. So those are all the domains of health, public health. So, lastly, we're going to talk about the health systems and policy reform. So, this is kind of talking about the health system in a nutshell. This is a big table. So, there are a number of health systems that are practiced all over the world. Some of them are kind of universal in the sense that the way that it operates is that everybody is automatically covered at birth or after they've reached a certain age or condition. You have the beverage health model that kind of looks at there's one payer and there's one provider. How this works is that healthcare is provided and financed by the government through tax. I believe Canada does something like that, whereby it's the government that is paying for health and it's government that is providing the health. And then you have the single payer, multiple providers. In this case, the government pays for the healthcare system, but they are more different healthcare providers, meaning that I'm trying to find a way to explain it. Okay, Medicaid, right? You can, when you have Medicaid or you have Medicare, you can go to most healthcare providers and get get healthcare services provided for you. You don't have to go to, let's say, a government hospital or something like that. So that is how the national health insurance system works. The beverage model, an example of that in the US would be the veteran hospital, and then you have the military, or you have the Native American health program, whereby it is the people who are paying for the service are also the people who are delivering the service. Then you have the Bismarck model. Multiple player, multiple provider. The payer and the employer, they fund a national insurance program through compulsory tax rule. So something like what happens with that is that everybody kind of buys into a health insurance, and it is kind of deducted through tax or some kind of payment structure. So, employer is paying, individual is paying, and all of that happens. So, in this case, so long as you have a job, you get insurance, and that kind of a system. So the US has an example of that in the health insurance, the employment-based health insurance that comes with it. But some countries have it in such a way whereby it kind of gives you a whole lot more benefits than the US's employment-based system does, which we will discuss much later in the course of this course. So, and then you have the non-universal coverage. What happens with the non-universal coverage is that people have to go out and purchase their own insurance. It doesn't come with nationality or age or condition. It doesn't come at birth. You have to pay for it. It doesn't come from employer or that sort of thing. So you pay for it. It's kind of a private healthcare insurance, and that is in the US. That's where most of the insurance kind of stays. You have those commercial health plans. And then the out of pocket is not really a healthcare model, but the reason why it's included is that unfortunately there are a lot of countries whereby a majority of the healthcare service that you get, you are going to have to pay for it out of your own pockets. So that is what we call out of pocket payment, and the US does have quite a lot of that, and that could be for those who are self-funding, who are kind of pay for their own self-funding, and those you have people who are uninsured, who kind of end up having to use the ER as a way of getting healthcare service. So, this is in summary some of the major laws and policies that has been passed or attempted to be passed in the US from 1929 when Theodore Roosevelt campaigned for the national health insurance to 2010 when the Affordable Care Act (ACA) was signed into law. So I've included a number of other laws that were attempted. Those that are in bold were those that were successful, and those that were that are not emboldened are those that are unsuccessful. If you have a closer look at those that are unsuccessful, a lot of them were attempts that were made to provide US with a kind of national healthcare coverage, which would make it a I want to go back here, which will make it a universal coverage. So it's been a number of attempts to get US here that has not worked. In for the most part, I think the closest the US came to a form of universal coverage was in ACA, which didn't really do that, but it's the closest that he has come. Or other attempts to move US towards the universal coverage has unfortunately failed a lot over and over again. But you can just kind of pause at this point and just have a closer look and see what laws were passed and when they were passed to kind of get a sense of it. So since the US has passed ACA, has things all become all great and lovely? Actually, not so much. There's still a lot of Americans who are still paying for healthcare out of pocket. Also, remember that the time that the ACA was passed into law and the time it really started implementing was quite a long. There was a big gap between that, and between then, there's been a lot of out-of-pocket Americans, whereby as at 2010, up to 20% of Americans were uninsured, while up to 16% were underinsured. When we say underinsured, we mean that they have an insurance, but the insurance is giving them so little benefits that is as good as not being insured. And this is according to the Commonwealth Fund of 2012. So that is where we end for today's class. Please remember to use the Q&A board if there's anything you're not quite clear about. To have a lovely day. Bye.